going to talk about the chicken app today.
Yeah, I have a mobile order for Parker.
Alright, I got checked in. You can go to pull around. Thank you.
Thanks. Thank you, you too.
Taco Bell go vegan.
Taco Bell go vegan.
Hi. Welcome
back to Physiology Phreaks. This might be a shorter one, but we are filled with Taco Bell and ready to go.
Filled to the brim with Taco Bell.
Yes.
Stocked right up.
Yes.
We're one clit down today. That's
yes,
all right,
I'm borrowing Christy's because I left mine at home. But anyway.
Tut.
Yeah, won't make that mistake again. This is going to be a little bit of a different one. I've been really into this podcast recently about medical mysteries and just like weird, rare things that happen to people. And I thought it would be fun for us to kind of research and then present one of these like to each other. So I'm going to go first. And I'm going to kind of talk about this and see what you think, because I think it's really fascinating and really interesting.
Very excited.
Okay. Imagine you're at the ripe age of 14. You're in
Not
school.
again!
You're in high school.
Okay.
Wait, how old is that, like freshman year? Yep,
yeah.
Like freshman year of high school. And you're sitting in your desk and you go to wipe your face, and when you bring your hand down, you see blood on your hand. And you're like, what the heck? And you rush to the bathroom, and you're washing your face off, and there's blood on your hands, but there's no wounds. You didn't pop a pimple. There's nothing coming down. You're noticing that it's like on the edge of your scalp, and you're just confused. And so you try to just hide it and go back to class, but you're a little worried about it. You go home, everything seems fine. Next day, you notice there's a pool of blood in your palm. Your hand has blood in it, but there's no wound. There's no source of the blood. There's just blood in your hand. So you try to wash it off. Your friends start to notice. They're like, why do you have blood on your face and your hands? Like, what's going on? And you're like, I don't know. And you're a little worried about it.
Bloody secretive.
Yeah.
That was
good. And you start, noticing that this just continues to happen every couple days or couple weeks. Is kind of varied when it's happening. What's causing it is unknown. Maybe you're hiding it from your parents, trying to make sure that they're not freaking out about you. You don't want them to think it's a big deal, so you're just keeping it quiet, hoping for the best. And then one night, your mom comes up and she's like, "Why do I keep finding blood in your clothes, bro?" And you're like, "Oh no." And you have to explain to her, "I just bleed out of my skin sometimes. I don't know what's going on. It doesn't hurt or anything." And she's like, "We have to go to the doctor right now. We're going to the doctor. This isn't normal." So you're taken to the doctor, and the doctor's like, you're not doing it. It's not happening right now. I don't know what's causing it. I don't see any lesions on your scalp or your palms or anywhere else that you're bleeding from. And then when the doctor goes, telling a nurse about it, the nurse is like, "This is the same places where Jesus was bleeding, on his palms and his scalp."
That was the first thought that came into my head when you said this.
Yeah. And she's like, "What if this child is a child of God? What if this is a sign?" And the doctor's like, I don't know. But they're like, maybe it's self-inflicted. Maybe she's doing it to herself, and she's, just trying to get the attention. Maybe she's super religious, and she's trying to get this religious attention. And so they have the nurse, sit in and watch you and make sure that you're not doing this to yourself. And then, in the middle of the night, your nurse comes over to wipe your forehead and notices that there is indeed blood coming straight out of your forehead for no reason. And she's convinced that you are the next Jesus Christ, but the doctor then is able to take that sample and find out what it really is. And it is probably not that you're the reincarnation of Christ. It's probably hematidrosis, which is a rare condition of sweating blood. And it is probably what, if the stories are real, probably what Jesus.
Wait, this is so cool.
Yeah. And it's super rare.
So cool.
I know. It's super rare. There's only been like a couple documented cases. Like I'd say like upwards of 50, lower than 200. And like they're.
Oh my God.
Yeah. Most of the people get it are younger than 18. Mostly women, which is interesting.
Okay.
And are mostly of Asian ethnicity.
Huh.
Yeah. the people who usually get it like sweat from like certain regions, like from their scalp, their palms, places on their torso. Those are like the most common places, but it can also be from your eyes, from your nose, like from the skin on your nose. Like and the reason that all of these things are happening and we don't know like why they're like coming from different places on different people is because we don't know what causes it really. We know what's happening. So basically the idea is that your skin, the pores on your skin start to fill up with blood instead of the like secretions and sebaceous isn't that like sebaceous excretions or whatever that they're supposed to. We don't know why this happens. It just happens sometimes. And again, it is really rare. Sometimes it will just go away on its own. Like in a lot of the cases, they'll be studying this person and they'll be like, okay, this is still happening, and then it just goes away.
Wait, okay, can I ask questions?
Yes, yeah.
Okay, number one, so so it's not like everywhere where you sweat, it's only like certain regions?
Yes, yeah.
And the regions are different on every single person?
Most of the time, yeah.
Oh my god. So, okay, but like, how do you like work out? What if you're like going...
Well, the thing is, it like, they call it like sweating, but it's not really sweat.
Oh.
Like, you can be sweating and not have it...
Okay.
Not like... In one of the cases, they had her, like, they were testing her, like, when they thought, like, you know, maybe she's doing it to herself.
Right.
They had her like run on a treadmill and start sweating and like really like vigorous exercise to see if that would induce it, and it didn't.
Huh.
Yeah. And like they say that like anxiety and high stress, depression, those things will increase the risk of like, or if someone already has it, will kind of like increase the amount of times that you'll see it. But also like it causes a lot of mental stress to like have this going on, and like it's scary, it's terrifying. They don't know why it's happening, what's happening. So it just kind of like is that it's a double-edged sword, like where you know it's caused by stress,
positive feedback loop,
and then you get more stressed because it's happening.
That's insane.
Yeah. And it involves both the eccrine and the apocrine glands.
Oh god, I don't remember that part of anatomy. Don't talk to me about apocrines. I'm just kidding.
It's okay, hold on. I have a diagram. Fear not.
Yes.
In one of these, oh my god, I have so many tabs open.
Vicarious menstruation?
Yes. Okay, so that's another thing.
That's what my thought would be, bro. If I wake up one day and I'm bleeding from my forehead, I'd be like, bro, my period came out the wrong end. The fuck?
My uterus is really doing the work.
My uterus is like in my frontal lobe.
So it also says that it can be caused by rare case of red tears, ocular vicarious menstruation. So this is another really rare
presentation of it.
Hemolacria. Sure. It's caused by various ocular and systemic conditions. It's due to being due to vicarious menstruation is even rarer, but this 25-year-old 25-year-old married female patient. Thank goodness they specified. Sorry. Okay. Guess what she was treated with?
Let me guess. Hold on. Antidepressants and birth control.
Birth control.
Yep.
Oh, that's so funny.
Pills.
So she was having bloody tears. Cyclical bleeding in extragenital organs during the normal menstrual period is referred to as vicarious menstruation.
Hold on. Cyclical bleeding in various non-genital organs?
What? Oh my god. Rabbit hole. Let's go to this. What is that? What does that mean? Pause. What? Is that possible? What? Okay, no, that just took me to... That's what...
Bang AI. Hold on. I have to bleed my foot right here. Okay. Ow.
It's very, very rare. Whoa. That's insane.
Fuck. Wait. She used to... She used to live happily with her family, according to her husband. Have you talked to her? Is she dead? Hello. At presentation, she was hemodynamically stable. Upon examination by ophthalmologist, visual acuity was 6 out of 6 in both eyes. Damn, better than me. No ocular swelling or congested vessels in conjunctiva. Anterior and posterior segments were normal. There was no bleeding from any other site.
That's so weird.
Wow. This is insane. Wait, so I don't think Jesus was real. I think he just had hematopoiesis?
No,
Or hematohydrosis.
Hematidrosis.
Hematopoiesis is just the production of red blood
It's
cells.
hematidrosis or hematidrosis. Like that's like they're
I
both called.
see.
It's called both things for some reason, which seems not smart to me. But
This is
menstruating eye, very rare but possible. That's not real. Sorry, it was
That
an
looks
image.
AI.
That's not real. That looks AI.
That looks AI.
Extragenital
cyclical bleeding.
What causes it? How? What?
Wait, why is it reportedly only seen in the nasal mucosa but can involve any other organ such as the lungs, stomach? Oh, endometriosis is a common cause of vicarious menstruation in which endometriotic tissue reaches extragenital places either via the hematogenous or lymphatic spread. What?
Wait.
Everything just leads back to endometriosis because endometriosis is just the growth of endometrial tissue, which is endometrium is just the innermost layer of the uterus, so it's the growth of endometrial tissue outside the uterus. So definitely, if you have endometrial tissue on your foot, baby girl, you got endometriosis.
Okay, so shockingly, this is another weird thing that happens to women that isn't researched. Wow, who would have guessed? Who would have thought?
Who would have thought?
Which also would make sense why hematidrosis happens more to women.
Yeah.
Maybe that's part of it, you know? Like, your blood is just, like, going places, yeah. I guess. Ocular endometriosis.
Isn't that f***ed up, dude?
That's horrible.
That's horrifying.
That's horrible. Oh, my gosh.
There was one time in... Wait, can I tell a quick story?
Yeah.
My sophomore year of high school, I was the most stressed I've ever been in my life up until that point. And I went to school one day. This was like a couple weeks before COVID hit. And I went to school, and I was waiting to go into the band room, and one of my friends goes, "Oh my God, your eye is bleeding, like bad. You need to go to the bathroom. Oh my God, what's wrong with you?" And I was like, "What?" Because I wipe my eye, I don't see any blood. I feel fine. There's no pain. And she's like, "Dude, your eye is bleeding, like it's bright red." And I was like, "What?" So I'm like about to puke. I sprint to the bathroom, look in the mirror, and turn up. I'll send you a picture. You can put it in the episode.
Really?
There's a big bright red glob in my eye. And it was just a blood vessel that had burst because I was so stressed and I was getting 4 hours of sleep for like 6 months on end. And also not eating enough and also so stressed.
Oh my God.
Yeah,
that's horrible.
But it wasn't like the blood wasn't coming out of my eye, but it burst, I think, in like the sclera potentially. And it just kind of takes like 6 weeks for it to clear up. But
oh my God.
Yeah, it was kind of like, hold on.
That's so scary, bro.
I'll show you a picture. Zdjęcie mam na telefonie. Sorry, that was like unrelated, but
no, that's so fascinating.
My point is, I can't begin to imagine how terrifying that must be.
Yeah,
especially if the blood is actively coming out of your eyes. Like,
yeah,
mine was just in my eye.
Oh my God, was it painful?
Not at all.
So, interestingly, one of the things that has worked in a couple cases to stop the bleeding is beta blockers.
Oh my God! Wait! This is so... Wait!
Right?
I have an interesting thing. Okay, sorry. Keep talking.
Although the mechanism of action of beta blockers in the treatment of hematidrosis remains unclear, vasoconstriction and inhibition of angiogenesis are likely involved. Angiogenesis is the physiological process of developing new capillary blood vessels from pre-existing vasculature.
Dude, this is crazy.
Isn't it?
That's like actually
it's like connecting
insane.
things. Things are connecting. So,
oh my God.
Beta blockers come back once again.
I've got my clit back. I've retained it back for a short amount of time, and it's leaving me again.
Oh.
Bye, clit. I'll miss you.
Hello, clit. I missed you.
Oh, not Ohm's law again, bro.
I don't want to hear about anybody's law about anything. I don't want to hear about anybody's constant. I don't care what you did in math. I don't want to know.
Dielectric constant, die.
Get out of
Okay.
here.
Nobody wants to hear about that.
Avogadro's law. Avogadro's constant.
I love Avogadro's
He's
law.
making stuff up.
He is making
That
stuff
number.
up.
Where did you get that, brother?
Or the other
Be
one.
so for real. You pulled that out of your butt. The pathophysiology of hematidrosis is unknown. The secretion of sweat-containing blood was reportedly caused by the disruption of microvessels around the sweat glands due to sympathetic nervous system hyperactivity in the presence of stress. So this is saying that it's like directly correlated to if you're more stressed out, that's what will bring it on. Not like, I think you have to be like genetically disposed, because I feel like if people were just sweating blood every time they got stressed, it would be everywhere. We'd be
covered in blood.
We'd be covered in blood.
Kind of are, but
yeah.
you know.
But I think that it's so interesting to me when we find out things and we don't know where they come from, and we don't know what's causing them. Like, it's like I feel like, and listen, I'm not a researcher. I'm not into research. I'm not a researcher. I don't like doing research, so like I can't talk. But like, I feel like it's having things like this where it's like, I feel like we should be able to figure this out. You know what I mean? And I'm not dogging on anyone who like hasn't been able to figure out hematidrosis and the mechanisms, but like, I don't know how I would figure it out, but like, someone's got to. That doesn't seem that crazy.
I think we can figure it out. Hold on, it's right here.
Maybe I could figure it out. Put me in, coach.
Put us in, coach. Beta adrenergic receptor antagonists decrease cardiac output, which means that beta adrenergic receptor agonists increase cardiac output, which means that when you block the beta site, you're decreasing cardiac output. So, and you said that if you're on beta blockers, it helps manage the condition. Yes, because beta blockers decrease cardiac output, so you're just bleeding less, I think.
Oh, okay.
But why? But how? But
why? But how?
But why?
That is the question.
But how? Huh. Well, maybe it does just boil down to beta blockers decrease cardiac output. So if you decrease cardiac output, you decrease the amount of blood flowing out of your pores.
Maybe
that. I mean, that seems awfully simple. It seems awfully reductionist. You know.
It does. It does. Beta blockers are cool. It's funny the way that they're being used usually
for anxiety.
Yeah. But yeah, I mean, it's like their idea is that it is the vasoconstriction of inhibition of the formation of new capillaries.
Isn't that so fucking cool?
Yeah, it is cool. And like there have been also, they kept mentioning how somebody kept talking, like it was like the two like main historical cases were like Jesus and another dude, and now I can't remember. Oh, Leonardo da Vinci also mentioned it and like talked about someone having it that he knew.
Wait, that's insane.
Yeah.
Hold on, this is crazy. Wait, so basically we have all this evidence to disprove the entire Catholic religion and we're just sitting on it.
Yeah.
We should not
low-key,
keep that
actually.
But that's insane, actually.
Yeah. And listen, hematidrosis is so rare, but I wouldn't be surprised if someone got it like, back in Jesus's era, that they'd be like, oh my God, this has to be an act from God,
I'm pregnant
because this is so weird. And your mom gave birth without having sex, and that's crazy.
And that's, yeah. Okay, but like, if you were birthed from a mother who did not have sex, and you had hematidrosis, I mean, I wouldn't. I mean, like, yeah, that kind of sounds like it would kind of fuck you up a little bit.
Yeah. But then I feel like he would be bleeding all the time. But maybe he was, and people just didn't like.
Maybe they just didn't pick it up.
Yeah.
But also, though, okay, here's the other thing, though. Because we do have evidence that Jesus... Sorry, this is just turning into a Jesus episode.
It's interesting.
It's interesting. We do have evidence that Jesus was crucified. We don't have evidence that he was holy, but we have evidence that he was a guy who existed.
He lived.
Who was crucified.
Probably. Yeah.
And so the cloths that he was wrapped in the tomb have blood on them, but it's probably also just from crucifixion. You know what I mean? Because if they stab you to a cross, I mean, you're probably going to bleed.
Probably going to bleed.
Right through your fucking extensor digitorum longus. Sorry. Basically, that's cool as fuck, though. Holy
Dude,
shit.
I know.
My God. Wait, psychogenic purpura? Oh!
What? Where are you seeing that?
This one. Wait, acute fear and intense mental contemplation are the most frequent cases, as reported in 6 cases in men condemned to execution. A case occurring during the London Blitz, a case involving fear of being raped, a case of fear of a storm while sailing, etc. In our case, the probable cause was chronic stress. Hysterical mechanisms and psychosomatic disorders are also believed to induce bleeding. Psychogenic purpura is supposed to be caused by hypersensitivity to the patient's own blood or autoerythrocyte sensitization and is characterized by repeated crops of redacted ecchymosis, gastrointestinal bleedings, and hematidrosis.
What? Okay.
Yeah, what is that? Wait, let's guess what it is and then let's see.
Okay, I think psychogenic purpura is being really stressed out and having weird things happen to your body.
I think it okay, so psychogenic is like it's something psychological.
Yeah.
Purpura, I'm just assuming is like another word for like dark red or black bleeding or something. But it's caused by a psychosomatic disorder.
So like bleeding because of psychosomatic.
Yeah, something like that. That's my best guess.
Okay. Oh, Gardner-Diamond syndrome, a rare stress-induced disorder causing painful, spontaneous bruises, primarily in women. What?
Wait, this is crazy.
And that's just like bleeding under the skin, which would make sense.
Yeah. So, okay, but how does blood cross the? Because I remember we're like learning about blood, and it's like, hold on, folks.
I present one disease and we end up learning about like 7 new ones.
Yeah.
And all of the case studies for all these things are like 15-year-old girls, and that makes me really sad.
I know.
Sorry, 15-year-old girls. As if being a 15-year-old girl isn't hard enough.
I know. Blood side, lumen side, epithelial side. I did that in the wrong order. How does the blood get out completely passes through the tight junctions and it goes through the...
Well, I think bruises are caused by of something breaking.
Yeah, but like how does it go, like in the case of it going outside of the skin, you know, true. I don't know how that works because normally you have to have a cut.
Yeah, you have some kind of like break in the lumen. Yeah. Maybe it's like a thinning of the... No, but that doesn't make sense. Or maybe if your blood is watery enough, it's just osmosing it right out of there. Osmosing.
Nothing wrong with that.
I don't know, man.
Wait, I can see my extensor digitorum brevis.
Well,
isn't this sorry.
You know, like learning about how like this is like going out of fashion, or like adapting out of it, and like not everybody has this.
Going out of fashion.
Yeah. Having this muscle is going out of fashion.
You know what one of the cadavers doesn't have?
Tell me.
The plantaris tendon.
What? Dr.
Griffith said that she's never in her however many decades of teaching ever encountered a cadaver without the plantaris tendon, and we have.
How is that possible? How is that possible?
It's super rare. It's I think it's, look it up how rare it is to not have a plantaris tendon, but plantaris is a muscle that originates the origin is the lateral supracondylar line of femur, I think, and it inserts into, I think it's oblique popliteal fossa. Girl, I don't know anymore.
I don't know any
of this
anymore.
It has a big belly and then has a long tendon that attaches to the calcaneus. Yeah. And it's absent in approximately 7 to 20% of the human population. So it's pretty rare.
Yeah.
And our instructor said that she had never, ever encountered a cadaver who doesn't have plantaris. And this semester, there's a cadaver that doesn't have.
That's so cool. Wait, which one is it? I might check that out because that's really cool.
You should. It's like actually really.
Once I
really
figure
cool.
out where that is.
It's just you're gonna want to flip it posteriorly, and it's gonna be in the popliteal fossa.
Oh, okay.
But just like look up plantaris tendon cadaver. You know it. You've learned it. You've seen it. you'll see it and you go, oh, duh, it's right there. It goes down
Oh,
and it's called the freshman nerve because it looks like a nerve, and all the freshmen think it's a nerve, but it's a
tendon. It's a tendon. All the freshmen think it's a nerve. It's actually a tendon.
All these jorks. Or wait, what are they called? Jocks. Sorry. I only got 2 hours of sleep.
And a jock, you're a jork.
I'm a jork.
Yeah.
Dude, I'm so sorry. I need to stop.
Don't be sorry. Live your authentic life. It's interesting to me that it's caused by overactivity in the sympathetic nervous system. Because it's like, you know, your sympathetic nervous system is the fight or flight. It's getting your heartbeat up. It's like making sure that all of your limbs and your brain have blood to supply you in case you need to run or fight or do something. And you're not like, you know, it kind of pauses your digestion because you don't need all of your energy to be there. And like just it gets you ready to do something, like maybe there's a little bit more epinephrine or something to kind of get that happening. But I wonder if it's because there's more blood in your extremities and like in your brain,
and it has like a higher like pressure behind it, because there's higher cardiac output during that time period.
I wonder if that's what it is.
We wonder.
That seems too simple too, though.
All those factors, though.
But yeah, like I feel like that's got to be at least part of it. It was why it's during the sympathetic and not just like, or during sympathetic activity, and not just like randomly.
Not just snooze-a-losing.
But there's cases of people just like it happening in their sleep. So like that doesn't make sense.
I think it is probably a combination of all of those factors, and it just depends like which factor is strongest for your genetic makeup, you know?
Yeah.
Which is just so weird.
Yeah.
Like, how does it cross the pores? Like, how does it go into the pore? I don't even know how people sweat. I don't know. Because sweating is just water. Like, it's excess water. So is it just like that the blood, like, fucking... Dude, I don't know. I don't know enough about physiology.
Oh, okay. So, I mean, we have glands that are specifically made to produce sweat in the skin.
Yes.
So I feel like it's not coming from the blood necessarily. You know what I mean? Like maybe it's like a different set of circumstances, and instead of like pulling fluid out from the blood, it's fluid being pulled out from something else. I just moved the mic away. That's dumb. I haven't thought about it enough. Physiology of sweat. How do we get here? So there's 2 to 4 million sweat glands throughout the body. That makes sense. Okay, but like how? Why is there sweat in there?
So eccrine is like the intrinsic ones that everybody has. And then what is it, the one that develops in puberty? Like apocrine?
Yeah. Compared to the total number of active sweat glands, the components of eccrine sweat are mainly water and salt. It also contains chemicals from the intestinal fluid and the eccrine gland. Intestinal fluid?
Isn't that just like electrolytes?
True.
Or no,
okay.
Actually, I don't know.
That seems right.
On that. Okay.
I don't know. It's okay.
Apoeccrine. Apoeccrine developed during puberty.
Oh, yeah.
I see.
So good. It may be spring break, but the physiology freaks never rest. Hopefully, maybe. I haven't slept in like a month. Oh my god, I'm just tired, bro.
Dude, I know. Dude, I've had 400 milligrams of caffeine every single day this week.
You want to know something funny? I started, at the end of the year last year, I thought it was really funny. Or at the end of the semester, people would do, like, classes skipped, you know, coffees bought, you know, like how many, like throughout the semester. And I've started counting how many energy drinks I've had. And like, I only started, like I like kind of estimated up until like last week.
Yeah.
And then since last week, I've been like logging it in my notes app and also taking a picture with it.
Okay.
So right now, all of my Snapchat memories are just me holding up a Red Bull, and it's gonna be beautiful. Like, cause like I think last week I got like 3 different ones.
Really?
Yeah. Speaking of, I tried the cherry Sakura one.
Yes.
Fire.
The sugar-free
so
or
yummy.
full sugar?
I had the full sugar because they
Okay.
didn't have a sugar-free
Okay.
version. And I also tried the coconut berry.
Which one is the coconut
It's
berry?
white. It's like the white edition.
Oh,
Or
okay.
something.
Is it good?
I liked it. I think it would be
Okay.
really good like during summer on like a hot day because it like tastes very coconutty.
Okay.
Like, but it's good. Like, I really liked it.
Okay.
I think the only Red Bull that I haven't loved was the like iced vanilla berry and the original. I'm just not into the original, and I didn't like the iced vanilla berry. I do not understand the hype.
That was so disappointing. I was
It
so excited to
was.
try it, and it just tasted like ass.
I
And it was
know.
so sad.
It's so sad. We're gonna ruffle some feathers with that one. But it's okay.
This week I had an orange Alani, 2 orange creamsicle Alanis, wild berry Rehab Monster, peach Rehab Monster,
Damn.
and a frozen berry Celsius.
Ooh.
And hold on, I had a Red Bull. I forget which one I had, but I did have a Red Bull this week.
Red Bull's the best, bro.
Bro,
I love
low-key,
Red Bull.
I'm gonna have to disagree with you. Have you had the orange creamsicle Alani?
I haven't gotten into Alani's.
Okay.
Should I?
Listen, we should just do a whole segment about energy drinks.
This is becoming that. It's okay.
It is becoming that. Well, because you know how you're like logging shit, and then I was gonna also do it with cans of beans this year, and I hit 17 and I just forgot.
Funny as hell.
But I might have to like estimate it and regroup because I eat I eat enough beans to feed the entire continent of like Europe. Probably it's insane, but
dumbass continent.
I really thought Red Bulls were like the prime of energy drinks. And then I had a Monster. And I was like, hold on.
Yeah.
Guys, hold on. This is good. And then I had a Celsius and I had an Alani. Celsius is like...
I think Celsius is buns. I started with Celsius. With Celsius. That was the first kind of energy drink I had because I thought it was healthy. And I thought their energy drinks were scary. And then it turns out Celsius is like way worse than any of them.
Yep.
But I started with them and I was like, ooh, this is yummy. And then I had Monster and I was like, oh, actually Celsius sucks.
Yep.
It actually sucks butts. It like genuinely tastes like mostly taurine with like a little bit of flavoring.
That's what Red Bull is starting to taste like to me.
I think, listen, I like Alani. But I've only had a couple of them. So
Which flavors of Alani have you had?
I had the peach one, which I really liked because I like the peach flavors a lot.
Yep.
And I like the Witch's Brew one.
Okay, the Witch's Brew one is shit from a butt compoundified squared to the 16th times 1,000 power times 100. In my very humble, brutally honest opinion.
Well, you need to open your palate.
It's okay. Well,
I like it. My salty little caramel apple flavored energy drink, and it makes me feel like I like the color of the can. I like the design.
Really cute.
I am a sucker for packaging. I am. Call me a consumer. I am.
That's why I've gravitated towards Monster.
They're so pretty.
They're so pretty. And here's the sad thing, okay? Because my whole shitting on the Witch's Brew Alani was really just performative because actually I've never actually had one, but one of my friends had one and I had like half of it. And it was okay, but it was just too sugary for me.
Yeah, they are really strong.
And I just don't like sugar that much. I'm a huge fiend for salt. Love salt. Sugar is not my jam. But the very sad thing about this is that I don't like carbonation. And when I discovered that Monster has non-carbonated energy drinks, my life was changed.
Have you had the Mango Fiesta Mango
Loco?
Dude,
I keep seeing it.
It's like the juice one, and it's not like low calorie. Like
it's like high sugar, but
it's so good.
Yeah,
and it's non-carbonated.
Okay,
it's so good.
I'm gonna have to try that because
Oh wait, maybe I'm thinking of a different one.
Oh, that's okay. No, because I've seen that one at gas stations.
But I like that one, but I can't remember if it's carbonated or not. Because I like the carbonation a lot, and I feel like I remember if it wasn't carbonated. But I thought it was. I don't know. Whatever. I don't know.
The one thing that
it's Mango Loco. That's what I'm thinking
like about the carbonation is that it prevents me from chugging it all. Because when I get the non-carbonated Monster Rehab, I chug it in like 30 seconds, and then I'm like, but it's the fun part of drinking an energy drink. And I have yet to try.
Mango Loco is carbonated. Sorry, continue.
There was this one energy drink that I had during finals week last semester. C4 energy drink. And I got it at a little coffee shop. I was working this final. I needed some caffeine. And I was like, I never tried this, but like, I've seen other people try it. It surely can't be that bad, right? I started drinking this. When I tell you, I feel like I drank battery acid, and I thought I was going to have to go to the hospital. Okay, that's a little bit of an exaggeration, but I have never felt this bad in a long time. I was super wired, super jittery.
Oh my God.
Felt like I was going to hurl chunks everywhere. I was like seeing things. I wanted to puke. I couldn't breathe. Like, dude, I'm telling you, don't drink C4 Energy. Like, shit is poop of the buns.
Wow. Strong words. Strong words
Sorry,
from
that was
Christy.
a really strong
No,
word.
I haven't had C4, but I believe you. And because I won't now. Like, if I ever get the opportunity, Christy said it's bad. I trust her.
Have you tried Ghost energy drinks?
I don't remember. Jack might have had them and let me try, but I
I
haven't.
haven't tried them either.
Yeah.
I just don't really. I mean, I like I have so many more flavors of Monster that I have to try.
Yeah.
That I'm not looking for a new relationship right now, guys.
Yeah.
I'm settled in with my Monster.
Oh my God.
Okay, what are your favorite Red Bull flavors?
Sugar-free strawberry apricot. Unbeaten for me. Sugar-free white peach. Ooh, this is hard now. This is difficult. Shit. Because there's like a couple, like those two I would take over pretty much anything else right now.
Really?
I love them.
Okay.
There's a bunch of other ones that I think are like tied for me.
Okay.
I like the green one. I would not put it in the top 3 for me. I don't remember which one it was.
It's
but
like
it's
Karuba
so sweet.
elderflowers.
Yeah.
It's way too sweet. I couldn't do it.
I like it.
Okay.
But it's like I liked the coconut berry one, but I think I would like it more in the summer. Oh my goodness. Shit.
Fuji apple ginger?
That one is really good. Oh my God, some of the blue ones I like too though.
Yeah.
I liked the Juneberry one.
You liked the Juneberry?
I did. I know that you hate it, but I did like it.
That's okay. No, I respect your opinion. It's okay.
I think that's what it is. And then but like I think that like a peach monster could also rival those for me because I like the peach monster a lot. Yeah.
I have to say for Red Bull, I think my top 3, and these are very small margins, like they're very, very close. But that being said, I would say number 1 is sugar-free white peach, number 2 is sugar-free Fuji apple ginger, and then number 3 is the strawberry apricot. But again, very close margins.
Yeah.
We could rearrange things a little bit. I did have the full sugar blueberry recently, and it was good.
Okay, I haven't had that one.
I didn't expect it to be good, but it was like fun. I wouldn't put it in my top placements, but it was decent. Apparently they used to have a grapefruit Red Bull, and I never tried it.
They also had a mango one long ago.
I need
to
that.
Bring them back.
And also the what is it? The passion fruit monster, peach monster.
Ooh, pocong.
And
the passion fruit one was good.
The passion fruit one is gas, and also the guava.
Oh yeah,
banger, so banger. But I have to say, the non-carbonated either wild berry or peach monster rehabs are my creme de la creme. The blue one, I don't know. I haven't tried it.
It's like electric blue. I got that one on my way back from St. Louis on the first time I went.
Okay.
And it is good. Like it's very like
the non-carbonated one.
I don't know. I don't remember if it was carbonated or not.
Oh, okay, that's okay.
It might have been not carbonated actually, but it like is like really, it's like really smooth. It's like it almost has like it's not creamy, but it feels so smooth that it almost feels like creamy. I don't know I don't know how to describe it. It's good though. It's interesting. It's a different experience.
Yeah, I've really been because like I really do think that caffeine is a placebo. Like, but I'm telling
no, it's not.
I know it's not, and not to go all like crazy.
You can go crazy.
But in my experience, like I do it it's purely hedonistic. Like I do it because I like the silly little pretty cans and the silly little yummy flavors and spending so much money on little cans, beautiful cans with
Yep.
yummy, awesome flavors
Yes.
that make my heart beat really fast.
Yeah.
And there definitely is a time and a place. Like,
Yeah.
trust. Like, there are some times where I'm like, I needed caffeine to get through this day.
Yes.
But for the most part, for me personally, it is purely placebo. And oftentimes I drink it just because it is so silly and yummy
Yes.
and whimsical.
Yes. Okay. Yes. Yes.
Nothing wrong with that also.
And it's like, it really is like getting a little treat.
Yes!
Like, it's a little treat. I saw a video the other day, and this guy was like, it was like a skit with himself. Like, it was like, but he was like, what if we made a really delicious, like, soda line, and there's a bunch of different flavors, and like they're carbonated, and you have like a ton of options, and they're like, oh my god, yes, this is a great idea. And they're like, the cans are really cute and like look really nice, really visually appealing. Oh my god, yeah, great idea. And let's put 200 milligrams of caffeine in there, in all of them. Like, we really didn't have to do that.
Yeah.
Like, they could just be like
Fun soda.
low calorie sodas.
Yeah.
But they're not. They have to be energy drinks for some reason.
Dude,
Which,
yeah.
don't get me wrong, I
Agreed.
like an energy drink.
Yeah.
But it'd be nice to have like non-caffeinated options.
Yeah.
Because like, what if I'm sick of the soda options, but it's 10 o'clock at night?
Oh.
Granted, I will still drink an energy drink because I am so good at sleeping. It doesn't matter what I consume
Bro, I
before
just
bedtime.
cut myself in the crease of my thumb.
Oh my god! How
on my
what?
book.
Ouch! 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 Ouch!
It's okay. It doesn't hurt that bad. We're chilling. But no, I agree with you. And listen, I used to be an Olipop hater. I've only ever had one once, but this was like not this past. It was the summer of 2024. I had an Olipop from the Harvard Walmart, and it was really good.
Really?
Like, it was really good.
What was the flavor?
I think it was the white one. I think it's like a vanilla root beer.
That seems right.
Shit had me bricked. And I will say, one thing that I really do like about Red Bull, even if I don't like their flavors as much, is that they have size and caffeine variety.
Yeah.
Sometimes I don't want 200 milligrams of caffeine, Alani Celsius Monster looking at you. I only want 80 because I want to fall asleep before midnight.
Yeah. I want to have a little treat, and it's like cheaper than getting a. They're also just not cheap. I wish that.
Dude, I know.
They're so good though.
I should get a Monster today.
I have to get gas on my way home, so I'll probably pick something up. Oh my
I think
god,
I'm gonna
it's
go.
an addiction.
Well, I have to go to the store. I have to take a nap, and I have to go to the store. And then I think when I go to the store, I'm gonna get a little Monster. So
my mom sent me a video the other day, and it was of an AI Chinese doctor telling people that caffeine is worse for you than alcohol. And I said, I personally have held in my hands the livers of people who have been heavy drinkers, and you can very clearly see the difference between a drinker and a non-drinker. I have never personally seen someone come in to the cadaver lab with their cause of death being energy drink overconsumption. But I don't know, man.
I also think it's like I think I used to be on, like, I don't want to say the hate train. You can see my dorsalis pedis so well. I used to be on the hate train of
my dorsal pedis.
My dorsalis pedis artery and my lateral metatarsal and my arcuate artery. Okay, sorry. But look at my arcuate artery.
You can see that.
This one right here.
Really? That's an artery?
Yeah.
Wow.
Or actually, probably maybe it's a vein. I don't know. Whatever. It doesn't matter.
I feel like it's probably a vein because arteries are usually deeper.
Yeah, but it's like the same. Like, it has the same pattern though. Like, it's on the arcuate line, and then that's the dorsal vein of the great toe.
Oh, that's so cool.
And
it is a great toe.
Look at dorsal vein of the little toe, and then dorsal vein. Okay, sorry. I'm just getting excited. Okay, sorry. What I meant to say is that I used to be on the hate train of like, oh my god, like, my energy drinks are so bad for you. And then you ask somebody, hey, why are energy drinks bad for you? They're like, there's sugar, we're all gonna die. Okay, yeah, I mean, sugar isn't like great for you, but also that's, oh my god, my cuboid bone. Sorry,
I love
guys.
Cuboid.
I'm so sorry.
My mom fractured her cuboid.
Really?
Yeah.
Recently?
Last summer.
Oh my god.
Yeah, it was bad. She was walking on it like the next day, and I was like, please don't do that.
Holy shit. But if you look at the contents of an energy drink, it's like caffeine 200 milligrams, synthetic taurine, vitamin B12, whatever the else other vitamins and electrolytes they want to put in there. No more than like 360 milligrams of sodium, water, vitamin C, vitamin E, whatever. And that none of those are like inherently bad for you. Does caffeine Can overconsumption of caffeine put excess stress on your heart? Correct. However, keyword overconsumption. Pure consumption of caffeine under the daily recommended limit is probably not, it's not going to kill you. And alcohol is, we unfortunately have decades and probably centuries or maybe even millennia of evidence that it is like really, 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 really bad for you.
Yeah.
Like,
I mean,
really, really bad for you.
Caffeine is a drug for sure. Like, it is a mind-altering substance in a way.
Wait, what?
Body-altering substance.
Okay.
That's
The
what
Hat
I meant.
Man,
Sorry.
like Benadryl.
Yes, like Benadryl.
Adenosine antagonist. Was it an agonist?
But alcohol is literal, like, actual poison. And that's why it works the way it does.
Look, you can feel my tibial tuberosity. Tibial tuberosity.
Cute.
So sexy.
Yeah, but like, also, I just responded to it and I was like, I am not trusting an AI doctor, bro. Like, and the person, like, there were people in the comments that are like, this is an interesting video, but why is it AI? And the person who makes it is like, it's about the message, not about the form that it's coming from. It's like, you're putting an old Chinese man in a lab coat on purpose to make it seem credible.
Yeah.
That's what you're doing. You're using AI to make your message seem more credible. If it was coming out of your mouth, maybe it wouldn't be as credible. Think about that, bro. I don't know. AI I hate AI.
I hate AI. God, I could go for a peach monster right now.
Oh my god, there's gonna be so many links in this description because I don't actually know. I did
beta blockers.
There's gonna be so many links and you can look at all of them.
You can look at all of them. Scroll your day away, baby.
Yes. Doom scrolling,
God,
but doom scrolling on medical journals. Consider that. Maybe still doom.
Medial malleolus.
Also, speaking of things in the description, we're gonna have an Instagram by the time this comes out.
Hard launch.
Yes, and this is what this is gonna be what the username is. We don't know what it is yet, so that's why.
But that's what it's gonna be.
And it will be in the description.
Actually, we do know what it is. It's just like a really, really high kept, like volatile secret. And if we were to leak it, I think
before
everybody would die.
It can't even be spoken out loud.
It can't even be spoken. Yeah.
So we'll probably post I don't know. I'd like to repost things that are cool and post stuff on the story that we find interesting. And if you want to just and I'll probably post an episode is gonna come out soon, so you can actually know because it's not consistent, but you can know if you follow us on Instagram. You will know.
Yeah. Yes, you, dear viewer and listener. Sorry.
I'm excited to hear eventually when we get back from spring break. Or when we get back from spring break and when we're not super busy, if you have a cool weird medical thing to
let me know. Hit me up, baby girl.
If you have any questions, comments, concerns, let us know. If you think we're dumb and stupid, don't watch
let us know.
Yeah, this was we talked about hematidrosis and energy drinks, and that's beautiful, I think.
Beautiful, awesome, cool, everything, and all those things in between.
All those things, everything.
And if you have any ideas of what we should do next, comment down below. If you're excited about something, comment down below. If you learned something cool recently in school, comment down below.
Yes, we love learning new things. Tell us about something.
If you figure out a way to exactly replicate the Taco Bell spicy potato soft taco potato specifically, also comment down below.
Yes, and if you have a weird medical diagnosis, tell us so we can learn about it.
Speak your truth.
And if you know how to cure hematidrosis, also let us know.
And maybe call the WHO.
Yeah, call someone.
The FDA.
Yeah.
I don't know, somebody.
All right.
Just perhaps. Okay.
Thank you so much for listening.
Thank you so much for watching, and as always, stay freaky.
Up and dripping down this.
It's kind of far away.
I'll grab it.
Okay, I'm sorry.
Hold this. Hold my clit.
What's it the one that you use in the equation for circumcision? Or hold on.
Pi?
Circumcision? No.